Hello again, my friends and future funeral professionals, which, oh my gosh, that must feel so freaking good to hear. And you are so close to being a future funeral professional. Doesn't that feel so good? I love saying it. I hope you enjoy hearing it. Because it's true. You've made it this far. You're there. So proud of you. We are going to be going over the glossary for microbiology for this episode. Now, I like to tell you guys when something's important, right? You need, the most important for science is obviously going to be embalming, which we are working on. Trust me, you'll have that this week. And restorative arts, or RA, whichever you wish to call it. David, that is his forte. He is doing RA, and you are going to love his episode because he is going to go all out and make sure you understand that in and out, which is, you have to understand there's a reason I was so excited to have this individual help me, okay? Like, the creator of Dead is helping us with this podcast. Like, what more could we ask for, right? I mean, maybe a very small 5% off discount code, David. Maybe. No, but okay. If you don't already have this book, I also want to make something clear. I have had some people, I've read comments. Like, I'm in these groups, guys. I read the comments and I try to delete them because they're not true. It's not me censoring people. It's inaccurate information. I do not make any money from these podcasts. I don't even get ads anymore. I did like the first 3 days, okay? I made maybe $1. The only money I have ever received for these podcasts are donations and subscriptions given to me gratuitously by my listeners, which, by the way, shout out to the 2 wonderful women who are currently subscribing to my podcast. You know who you are. I don't really want to call you out because I don't know if you're comfortable with that. You know, I always put you in the notes. You guys have no idea. Literally $1. This stuff is so expensive. But I'm doing it because I want to help people. It's okay. But do not have the audacity to claim that I'm trying to sell David's book for him to get money. Because that is so not true. I am promoting David's book because it's accurate. Y'all are so stuck on Taggart notes and they are so unbelievably outdated. You know what? I read Taggart notes out loud, right? Yeah, episodes, you know it. I have to stop recording and skip sections because it literally says as of 2010, 2015. You really think that the NBE or the conference is going to be testing on stuff from 2015? Direct language? Yeah, sure. You look at people say that they pass, and I used the Taggart notes. They used it. What else did they use? Betcha. A lot of the times I use that and the Dead program. It was the Dead program that did it. And their textbooks. Stop letting these people lead you down this because I used to believe it myself. Okay? Once I met David and he educated me, I reread the Taggart and I went, oh my goodness, he is so right. He bought the copyrights so he could make these correct. So with that high horse, let me dismount from that. All right. So if you already have this book, great. Pages are going to be, did I already say that? I think I already said the pages. Whatever. If I didn't. Pages are going to be 282 through 285. Now, if I already said it, I apologize. If you don't have his book, you can go to the Dead program website, which I will link in the notes. You go to resource materials, link in the notes in case it doesn't work. I just want you to be able to get to it in case that doesn't work, sometimes technology. Now, he has an arts and he has a science. You can either buy one or you can buy both. It doesn't matter. If you choose to buy both, you will still get $25 off of each of them. So $50, right? I have told people if that doesn't work for some reason, this is what I have been told, is that you get 50 off. It's 25 off each book. If it doesn't charge you shipping and it doesn't want to do it, just be squirrely and buy them separately. I mean, I've been told it's off both books, and you get me, all right? I highly suggest investing in these textbooks, and their resale value right now, they're not going to go anywhere. Like, you will resell them, okay? So just I wouldn't highlight them a bunch. I don't think you really need to. The way they're set up, I don't see you needing to do that. I think you can resell these suckers, especially in one of those NBE groups. So, any hoodles, we are going to go ahead and move on, and we're going to go ahead and do our audio recording with David and Miss Cain and have a lot of fun. And like I said, I didn't say this actually. We kind of, at the end, trail off onto the subject of cats and just have some fun. So what I'm going to do is I will go ahead and in my notes put in the timestamp of when the glossary terms end, where it ends, and where my outro begins for you. So you don't have to listen to all that if you don't want to. It's lighthearted. It's a distraction. I know some people, when they're doing this, it really helps. I really liked doing that. So with that being said, let's go ahead and kick this sucker off, okay?
Hello, we are going to review the glossary for pathology, starting with the term abscess,
which is the localized accumulation of pus.
Acquired,
a disease, condition, or abnormality that is not hereditary or innate.
Acromegaly,
hyperfunction of the pituitary gland after ossification has been completed.
Acute,
a disease with rapid onset and a short duration.
Allergy,
having a hypersensitive immune response to a foreign substance.
Amelia,
congenital absence of one or more limbs, not to be confused with the name. I know my sister's probably listening, not you. Anyway.
Sarca,
generalized edema in subcutaneous tissue. Sorry about that.
Anemia,
a decrease in the number of erythrocytes, hemoglobin, or both.
Aneurysm,
a localized dilation of a blood vessel.
Aplasia,
the failure of a tissue or an organ to develop normally.
Arteriosclerosis,
the disease of the arteries resulting in the thickening and loss of elasticity of the arterial walls, and is an embalmer's nightmare, let me tell you. You agree with me, don't you?
100%.
Yeah. All right.
Ascites,
accumulation of free serous fluid in the abdominal cavity.
Atherosclerosis,
a form of arteriosclerosis marked by the deposition of lipids in the inner layer of arterial walls.
Atrophy,
a wasting, decrease in size of an organ or a tissue.
Autopsy or postmortem examination,
a postmortem examination of the organs and the tissues of a body to determine the cause of death or pathological condition.
Cachexia,
a general state of ill health associated with emaciation.
Carbuncle,
I love that word so much. Several communicating boils of the skin and subcutaneous tissues with the production and discharge of pus and dead tissue.
I like how they say communicating as if these boils are talking to each other.
Right? Are y'all friends? Is there like some network we don't know about? Do they have Facebook? Whatever. Anyway.
Carcinoma.
A malignancy of epithelial tissue.
Cavitation.
Formation of cavities in an organ or tissue, frequently seen in some forms of tuberculosis, aka TB, for those of you who only see it as TB. Anyway.
Chronic.
A disease with a slow onset and long duration. Now, I am one of those lovely, lucky people. I have systemic lupus, which is a chronic autoimmune disease. And that is exactly what it is. A disease with a slow onset and a very long duration. Ugh. Blech. Anyway, so there's an example. I just wanted to give you a personal example of one. All right. Sorry about that.
Cleft palate.
All right, congenitally malformed palate with a fissure along the midline.
Clinical pathology.
Pathology that uses clinical analysis and other laboratory procedures in the diagnosis and the treatment of the disease.
Communicable.
A disease that may be transmitted either directly or indirectly between individuals by an infectious agent.
Complication.
An unfavorable condition arising during the course of disease.
Concussion.
The immediate and temporary disturbance of brain function as a result of trauma.
Congenital.
That means present at birth, and you need to know that. Very important.
Congestion.
Accumulation of an excess of blood or tissue fluid in a body part. Also important to know.
Contusion.
A bruise often accompanied with swelling.
Cretinism.
Congenital hypothyroidism resulting in the developmental let me redo that. Congenital hypothyroidism resulting in developmental disabilities. Got it. Wow.
Cryptorchism.
Why does that say that twice?
It also, I believe, is pronounced cryptorchism.
Oh, I see the extra syllable.
Yeah,
I swear that's total inside joke. Anyway, all right, failure. That just fell on its face. All right. So failure of the testicles to descend into the scrotum.
Cyanosis.
The bluish discoloration of the skin or mucous membrane due to the lack of oxygen.
Yeah, so we're going to see that in a lot of our cases where someone has either been strangled, asphyxiation of some sorts. So very, very common to see.
Yep, absolutely. All right. Moving. Sorry, I interrupted you. Cyst. All right. A closed sac or pouch with a definite wall that contains fluid, semi-fluid, or solid material. Now, remember, the body likes to absorb water. So if there's a cyst and it's got some water in it, your body's going to try and suck as much of that out of there as it can because it shouldn't be there. So it can end up, like it says, contains fluid, which AKA it has a lot of dilution, or semi-fluid, which means it sucks some of that out of there, or solid material, which means it's sucked everything that it possibly can. And it's only got its solid left, So just to help you kind of clarify the different terms there. I hope that helps. Moving on.
A lot of people with a cyst want to pop them, especially if you're like a baker. But the problem with cyst is because it is that closed sac, if you don't remove that whole pouch, it's just going to continue to fill with fluid. So you don't want to pop the cyst. If you have a cyst, you have to go to a professional for that.
Gosh, that made me shudder. All right. With that in my mind.
Deficiency.
A condition due to lack of dietary or metabolic substance.
Degeneration.
The deterioration of tissues with corresponding functional impairment as a result of disease or injury.
Dehydration.
Guys, these should all be such easy points for you. Like, think about them as yourself. Like, how do you feel when you're dehydrated? Do you feel loss of moisture from body tissue? Because God knows I do. So there you go. Loss of moisture from body tissue. Easy point.
For sure. Just think about where you have heard these terms in other areas, other studies.
Yes. I'm like, guys, think about it in real life. Like hypo, hyper, you name it. So absolutely. All right.
Diagnosis.
The term denoting the identification of a disease or syndrome to recognize the nature of a disease.
Dilation.
Or it looks like dilation is the other pronunciation.
Dilation or dilatation.
Ah, thank you. Okay. See, anyway, the condition of the heart being enlarged due to stretching as a result of disease. Ah, okay, been there. I'm familiar with that. All right.
Dry gangrene or ischemic necrosis.
I love the word necrosis. Necrotic tissue due to a reduction in arterial blood supply to a body part that remains aseptic.
Dysplasia.
Abnormal development of tissue.
Ecchymosis.
Superficial bleeding under the skin or a mucous membrane. Also, a bruise. So just make it easy for yourself. If you see that question, ecchymosis, bruise. Done. For me, anyway.
Right. The other time you're going to see that is ecchymosis of the eyes, which just mean black eyes.
I've seen it as a bruise, actually. I mean, I don't want to say too much, but it came up as a bruise for me.
Oh, it can. Yeah. It definitely is a bruise, but
I get what you mean about the eyes.
A lot of times when we see it in test questions, they're asking about ecchymosis of the eye or to black eyes.
You're
like
right.
Someone's the black angle.
You're right. I'm not going to argue with you. All right. So moving on. I just wanted them to know bruising is the important thing you want to remember.
Ectopic pregnancy.
All right. Implantation of a fertilized ovum outside of the uterus. And oh goodness, it hurts.
Oh, I believe it.
I've not been there, but my friend was hospitalized over that. And I'm good.
No.
All right.
Edema.
Abnormal accumulation of fluids in tissue or body cavities.
Emaciation.
The excessive wasting away of the body.
Embolism.
A sudden obstruction of a blood vessel by debris.
Now, an emboli is a free-floating particle. Could be a clump of bacteria, a clump of plaque, something that is floating through the cardiovascular network, and then it gets stuck, and that's when it becomes an embolism.
Why did you need to unlock another nightmare fuel for me? Oh my goodness.
I think about this all the time.
For me, it's aneurysms. I am absolutely, I am terrified of aneurysms. So same.
Yeah, because you can't predict them and they just happen. Yeah,
exactly. It's like you can bonk your head, and I've been tested. I get tested for them. I do the MRI thing, and they're like, "You're fine," and I'm like, "But what if?"
I need to know.
I get out of a car, I hit my head on something stupid. I'm like, "Oh my God, that's it."
the dark side of death care. When
You're right.
Well, all the ways you can die.
Med school did that to me. I swear on everything that is holy. Since I was 20, I was scared of everything. So, but yes, you were absolutely right. Anyway, moving on from this nightmare fuel. This isn't going to get any better, is it?
No, probably not. Emphysema.
All right. Oh God, it really doesn't get any better. A collection of pus in a body cavity, especially the pleural space. Oh God. All right. I can
Endemic.
A disease that is continuously present in a given population. Now, y'all should be very familiar with pandemic and epidemic. All right. And epidemiology is next. So y'all should be You guys should know these. These should be easy points. So with that, would you like to go ahead and after epidemic?
Endogenous.
All right. Produced or originating from within a cell or organism.
Epidemic.
Ugh. Higher than normal appearance of an infectious disease or condition with a given population. Now, y'all should know that. So I swear I'm sticking to that. Easy points.
Epidemiology.
The study of the distribution and determinants of diseases and wellness in populations and the use of this data to enhance public health.
Epilepsy.
A chronic neurogenic disease marked by sudden alterations in consciousness and frequently by convulsions.
Epistaxis.
Bleeding from the nose. Super easy point. I don't know why for me anyway, but I believe it will be for you. Have fun with the next one.
Erythrocytosis or polycythemia vera.
I could not have done. All right. An increase in the number of red blood cells.
Etiology.
The study of the cause of disease.
Exacerbation.
Increase in severity of a disease.
Exogenous.
You know, I've been saying that exogenous this whole time, and I'm embarrassed. Originating.
I don't think you could do either, honestly.
Yeah. I mean, my professors at Gupton seriously had like 3 or 4 different ways of saying the same freaking word every time, and it baffled me. All right. Originating outside a cell, organ, or organism.
Exsanguination.
Loss of blood to the point where life may no longer be sustained.
Exudate.
Any fluid released from the body with a high concentration of protein, cells, or solid debris.
Febrile.
Pertaining to or characterized by fever. So febrile, fever, febrile, fever. Got it? All right. I believe in you. Okay.
Fulminating.
Having rapid and severe onset, usually fatal. Now, could you please elaborate on that? Having rapid and severe onset of what? That's usually fatal.
Of the disease. So,
okay. All right.
Like
gotcha.
some types of, like there's bacterial, viral, and fungal meningitis. So one of the meningitis is the onset can be within 2 hours, and people can die within those first like 4 to 5 hours.
Yeah, that the I'm thinking of the brain one is just. I know that's really simplistic, but you know what I mean?
Yes. All right. I guess an aneurysm could be fulminating, rapid, severe onset.
Okay. Yeah. I feel like if there was that word saying what, I just feel like it's missing that keynote, but now that clarified it for my listeners, and I'm sure they'll appreciate that. I know I learned something today. All right. I also absolutely love this next word so much. I can't wait to hear you say it. Please say it. Bless me.
Furuncle.
Yes. It's up there with desquamation with one of my favorites. All right. An abscess or pyogenic infection of a sweat gland or hair follicle. I know, guys, totally like not worth how exciting it gets for me, but it's just the word that does it, okay? Don't judge me. Don't hate.
If you have a favorite word, it's going to help you remember it. And then when you get that question, you're going to be like, that's my favorite word. I know it.
Now, for the next one, I am just going to ask you to read the whole thing because I always it takes me so long to say that whole word.
So
people familiar with my podcast know that is an like, I always go, okay, guys, it's tissue gas. Just remember, you're looking for this word and this word. It's tissue gas, okay?
Sure. So gas gangrene or tissue gas is necrosis of a tissue infected by the bacteria Clostridium perfringens. Sometimes it's shortened as C. perfringens because the genus can be shortened.
I love you for that. Thank you. I hate having to say that word out. Like, oh.
Yeah, a lot of our bacteria have some pretty crazy names.
All right. Are you ready to move on?
Sure. General pathology.
This deals with the study of the widespread processes of disease, such as inflammation, degeneration, necrosis, or premature cellular death, repair, etc., without reference to particular organs or organ systems.
Goiter.
Enlargement of the thyroid gland.
Gross pathology.
Now, I know it sounds like something completely different, but hear me out. Totally not. It is the study of changes in structure of the body that are readily seen with the unaided eye as a result of disease, meaning you do not need a microscope to see it. That's gross pathology. All right. Moving on.
Emesis.
Vomiting of blood.
Hematoma.
Tumor-like swelling of blood.
Hematuria.
Now, remember, guys, uria, remember when we did those prefixes and suffixes? If you study those, the past couple that we've done should be pretty darn easy for you. Blood in the urine.
Hemophilia.
A hereditary bleeding disorder marked by a deficiency of blood clotting proteins.
Hemoptysis.
That is blood in the sputum.
Hemorrhage.
That is escape of blood from the vascular system. Not good.
Hereditary.
That would be a genetic characteristic transmitted from parent to offspring.
Hernia.
Abnormal protrusion of part of an organ or tissue through a weak spot in the wall that normally contains it.
Hydrocele.
Now, is that also pronounced hydrocele?
Probably.
Have you heard that?
Probably. Let me see.
I mean, I'm just curious. Like I said, meeting you, I'm curious because I have an opportunity to ask somebody that knows what they're talking about, as opposed to some of my teachers.
Well, Google has it as hydrocele.
Okay. All right. Cool. So
I've always pronounced it as hydrocele, but
all right. Well, then both of them, yay. Because a lot of my listeners are still in school, so I don't want them to get confused. And I know that I learned both ways, literally the way you said it and hydrocele. So I used to get so confused listening to their lectures. I never bothered. I would just go look at their PowerPoint and go, oh, that's what they were talking about. So
yeah, I think a lot of these differences in pronunciations have to do with scientists and from around the world doing these discoveries or just translations. So I'm sure there's probably multiple ways to say majority of these words.
I always like to remind people, I'm like, guys, I am in Myrtle Beach, South Carolina. I went to Gupton Jones outside of Atlanta. Like, give me a break. From Connecticut originally, from Minnesota, from Seattle. Like, I have so many accents. Like, just let me have it.
Yeah.
So, all right. Moving on. Hydrocele. Abnormal collection of fluid in any sacculated cavity in the body.
Hydrocephalus.
Excessive accumulation of cerebrospinal, love that word, fluid in the ventricles of the brain.
Hydronephrosis.
Distension of the renal pelvis with urine as a result of obstruction. Ugh.
Hydropericardium.
Abnormal accumulation of fluid within the pericardial sac. Also, unpleasant.
Mm-hmm. Hydrothorax.
Oh, God, why do we have to do these? They're so unpleasant. Abnormal accumulation of fluid in the thoracic cavity.
Hyperemia.
Excessive blood in an area of the body.
Hyperplasia.
The increased size of an organ or tissue due to the excessive but regulated increase in the number of its cells. Now, I have personally, being a trade embalmer, we had somebody who died from liver failure. He was as gold as the Golden Buddha, and they did an autopsy, and his liver was huge. I have never seen, well, close. That was one of the biggest livers I've ever seen. So increased size of an organ, there you go. Your liver can get huge. All right. Sorry, moving on.
Hypertrophy.
The enlargement of an organ or structure due to the increase in the size of cells composing it.
Hypoplasia.
Underdevelopment of a tissue, organ, or the body.
Iatrogenic.
Any injury or illness that occurs as a result of medical care.
Idiopathic.
Of unknown cause.
I have an idiopathic illness. I have
Really?
idiopathic urticaria, meaning I get hives for no reason. My body just triggers itself.
How long have you had that?
Almost 10 years.
Oh my God. That is bizarre.
Mm-hmm.
I've never met anybody with one of those.
Yeah, it's kind of rare. Yeah.
I'm going to have to be friends with you now. All right. Moving on.
Infarction.
Death of tissue due to a lack of blood supply.
Infection.
A disease caused by microorganisms, especially those that release toxins or invade body tissues.
Infestation.
The presence in or on the body of macroscopic organisms.
So that's going to be things like fleas, maggots, lice. Those are macroscopic organisms.
Would bed bugs count?
Yes, that would be infestation.
Right.
Whereas infection is going to be microorganisms, bacteria, viruses, things like that. So that's the difference between
is bugs.
Yeah. Yes.
That's how I like to simplify it as bugs.
Yeah, essentially. Yeah. That's a good way to think of it.
All right. I'm glad I'm not totally wrong there. Okay.
Infiltration.
The passage and accumulation of a substance into cells, tissues, or organs.
Inflammation.
Oh God, my arthritis is crying already. A tissue reaction to irritation, infection, or injury marked by localized heat, swelling, redness, pain, and sometimes loss of function. Sorry.
Intoxication.
The state of being poisoned by a drug or toxic substance. So on that note, I always tell you guys, you need to know the definition the NBE wants. When you see intoxication, I can almost promise that they're going to lead you on and try to trick you with what you think intoxication means. That's what they want. They want the state of being poisoned by a drug or toxic substance. Not inebriated, not drinking too much, not ingesting intentionally. That's what they want. Okay? Sorry, off my soapbox. All right. You ready?
Ischemia.
Reduction in arterial blood supply.
Jaundice.
Yellowish discoloration of the tissues due to the presence of excessive bilirubin in the blood.
Lesion.
A circumscribed area of pathological pathologically altered tissue, an injury or wound.
Right. We could have just gone with an injury or wound, you know?
Right? Dang. Wow. Lesion, an injury or wound. There we go.
Leukemia.
Wow. All right. Did you already say the next one? I'm so sorry.
No, leukemia.
All right. A malignancy of the what's that word, babe?
Hematopoietic.
Hematopoietic. I got it?
Mm-hmm.
Okay. A malignancy of the hematopoietic, see, I can't even, tissues characterized by a massive increase in the number of white blood cells present in the body.
Leukocytosis.
Increase in the number of white blood cells in the blood.
Leukopenia.
Abnormal reduction in the number of white blood cells in the blood.
Lymphadenitis.
Inflammation of the lymph nodes, which I feel like, I don't know about you, because you have one of those too, like unseen illnesses. I have those like all the time for no reason.
Yeah. I mean, anytime you get like a sore throat or any type of sinus or sniffles, you're going to get inflammation of the lymph nodes just as your body's just trying to filter more.
Or even when you don't have any like visible symptoms and you're just feeling a little off, you can feel some and you're like, oh, I guess I'm fighting something. It's bizarre. Lymph nodes are the telltale. They're
for
tattles.
sure.
Tattletale. All right, babe. I'm ready for your next one.
Lymphoma.
That is not it. 34.
Lymphedema.
An abnormal accumulation of tissue fluid in the interstitial spaces due to lymphatic disturbances. Now we're ready for lymphoma.
Now lymphoma. Too many lymphs.
I know. Malignancy of lymphoid tissue.
Okay. Malformation or anomaly.
A defect or deformity.
Medico-legal or forensic pathology.
The study of disease to ascertain cause and the manner of death.
Melena.
Blood in stool. You never want to see that. All right.
Metaplasia.
Conversion of one kind of tissue into a form that is not normal for that tissue.
Metastasis.
Transfer of a disease from its...
I'm sorry. Metastasis.
You know, I say that I do the same thing. I'm like, sometimes they say metastasis, other times they say metastasis. I do the same. I am so glad that I am doing what an educator that's done this a long time has done, because it makes me feel a lot less embarrassed.
That's when you just read them, you're like, yeah. No, wait.
Very hooked on phonics. English is my second language. I don't tell a lot of people that. And I mean, I'm 34, so I really don't have that as much of an excuse anymore. But like when I was in med school, I knew these words from like reading them. I knew what they meant. I could spell them. But when it came to pronouncing them, that was hooked on phonics was all I had.
Yeah.
I had to sound them out. So like here I am trying like this podcast. And that's why I asked David, I said, I need help with this because these words, like they look like one thing. I could probably get it close, but I don't want to sound like I don't know what I'm talking about. I do. So I'm so grateful that I have somebody like you who really does have the pronunciation down and can send it home. So anyway, all right. Transfer of a disease from its primary site to a distant location.
Microscopic pathology or histopathology.
That is the study of microscopic changes that cells, tissues, and organs undergo as a result of disease.
Moist or wet gangrene.
Real mature, right? Necrotic tissue resulting from inadequate venous drainage accompanied by the invasion of saprophytic bacteria.
Morbidity rate.
The rate of cases per year of certain diseases in relation to the population in which they occur.
Mortality rate.
The number of deaths in a given time or place or proportion of deaths to a population.
Necrosis.
Pathological death of cells, tissues, and organs while still a part of the living organism.
Neoplasm.
I told you all this is important. Please believe me. I know it sounds silly. The abnormal, excessive, and uncontrolled multiplication of cells with the formation of a mass or new growth of tissue.
Nosocomial.
Infection acquired in a healthcare setting.
Occupational disease.
A disease that is related to one's working conditions.
Osteomalacia.
Abnormal softening of bones in adults.
Osteomyelitis.
Inflammation of bone and the bone marrow. Ugh, that sounds painful.
Osteoporosis.
Loss of bone density, and they should have put most commonly seen in women.
Yes.
But alas, because I recognize that I'm not going to say anything else. Anyway.
Pandemic disease.
Widespread epidemic. Possibly worldwide. As I've said before, y'all, we've gotten through COVID. Y'all should know this stuff. Easy points. Sorry.
Pathological anatomy.
Study of structural changes in the body caused by disease.
Pathology.
Now, I'd like to add to that. Here's a gross one. Did you know? Well, you know, but hey, listeners, a good structural changes in the body caused by disease. If you get gonorrhea or chlamydia, well, I think it's gonorrhea, and you don't treat it promptly, and you're a man, it'll scar your stuff like morbidly, immensely. So as far as study of structural changes in the body caused by disease, that's a good one. So you got quiet. I'm sorry. I'm morbid. I used to be an autopsy tech, and my pathologist that I worked with like was obsessed with that. He was like, how can we fix that?
Yeah, it is a problem. There are now resistant types of sexually transmitted infections.
Yes.
So it's harder and harder to treat. So
yes, syphilis and gonorrhea, there are superbugs, especially syphilis, and they are causing some serious problems. So anyway, that's a whole other topic, and you will get me going. Oh my gosh, like I find that fascinating. So all right, ma'am, number 34.
Pathology.
The science that deals with the study of disease.
Pathogenesis.
The origin and development of a disease.
Petechia.
You need to know this, my listeners. I love you, and I'm going to red flag this. Antemortem, pinpoint, extravascular blood discoloration, visible as purplish hemorrhages of the skin. Please know that. Sorry for clapping at you. I'm so sorry. Anyway, moving on.
Phocomelia.
That is a congenital condition in which the proximal portions of the limbs are poorly developed or absent.
Physiological pathology.
The study of functional changes in the body as a result of disease.
Pigmentation.
Normal or pathological coloration of skin or tissues.
Pneumoconiosis.
I believe in you. Infiltration of the lungs with various forms of dust. Ugh, makes me want to cough.
Pneumonia.
Inflammation of the lungs due to infection.
Poliomyelitis.
Inflammation of the gray matter of the spinal cord as a result of a viral infection.
Polyp.
A growth or mass of tissue that protrudes from a mucous membrane.
Prevalence.
Number of cases of disease present in a specified population at a given time.
Prognosis.
Prediction of the outcome of the disease.
Prostatitis.
Inflammation of the prostate gland.
Yeah, anytime you see itis at the end, that's going to be inflammation. So that's the key. Itis, inflammation.
Absolutely. I tell people, I'm like, you gotta get familiar with your prefixes and your suffixes, because these will make so much more sense. You'll be able to kind of like narrow them down. Totally agree with you.
Purpura.
Condition in which spontaneous bleeding occurs in the subcutaneous tissues, causing the appearance of purple patches on the skin. Know that. Okay, sorry. I hate doing that to you.
That's okay. Pustule.
Pustule, a small elevation of the skin containing pus, and those ones you can go ahead and take care of. You don't have to, I guess, go to your doctor like a cyst, I suppose. I think most people do that.
Just be sanitary.
Clean that sucker out. Don't give yourself staph. All right.
Recurrent.
Reappearance of symptoms after a period of remission. Having lupus, gotta say, best thing ever. And I totally say that in sarcasm.
Regeneration.
The replacement of damaged cells with normal cells of the same type, i.e. your liver, believe it or not. Your liver regenerates.
Your skin will too.
Yep, that too. I just go to liver. I don't know. Because I find that fascinating that you basically get it in your liver after 7 years.
Remission.
All right. A cessation of the symptoms of the disease.
Repair.
The replacement of damaged tissue with fibrous connective tissues.
Resolution.
The termination of the inflammatory response with the affected part returning to homeostasis.
Homeostasis. I
Oh,
think so.
what did I read?
Homeostasis.
Wow. You know what? This is what happens when I read ahead of myself and I think I know the word. I know homeostasis. That's like equilibrium. I'm an idiot. Okay. Thank you.
No, I just
Thank you for catching that. I was looking at rickets. I shouldn't have been. Anyway.
Rickets.
All right. A disease of infants and young children caused by deficiency of vitamin D resulting in defective bone growth. Now, is that or polio what Kennedy had? Do you know?
I don't know. Dr. P would probably know that. But rickets gives you like the bowing effect of your legs, where your legs
Okay,
bow
I
out.
think he had polio. All right, never mind. All right, moving on. Totally doesn't matter anyway. I was just curious.
Sarcoma.
All right, a malignancy of non-epithelial tissue. I'm actually embarrassed I don't know that about Kennedy. Wow, I usually do. Anyway.
Signs.
Objective indications of the presence of disease.
Special pathology.
Deals with the specific features of disease in relation to particular organs or organ systems.
Spina bifida.
A congenital defect in which part of the vertebral column is absent or there is incomplete closure.
Sporadic.
A disease that occurs in a random or isolated manner.
Stenosis.
Abnormal construction of a passageway or orifice.
Symptoms.
Subjective indications of the presence of disease.
Syndrome.
Set of signs and symptoms associated with a particular disease.
Teratoma.
A congenital tumor formed by various types of tissue.
Thrombocytopenia.
An abnormal decrease in the number of platelets. Wow.
Thrombosis.
The formation or presence of an attached blood clot.
Yeah, so a thrombi is that blood clot that forms, and then the thrombi can detach and become an emboli, becomes that free-flowing particle. Right. Really, it's a thromboemboli if it was started as the blood clot and then broke away, but most people just refer to it as an embolus or as emboli if it's free-floating through the blood vessels, and then if it gets stuck, then it becomes that embolism.
New fear material unlocked. All right.
Ulcer.
An open sore or lesion of skin or mucous membrane accompanied by sloughing, such a great word, of inflamed necrotic tissue.
Uremia.
A toxic condition by the retention in the blood of waste products normally excreted in the urine.
Valvular insufficiency or incompetence.
The failure of a heart valve to close tightly, allowing for a backflow of blood.
And our last one, vesicle.
Blister-like elevation of skin containing serous fluid. Woo, we did it! Yay us! Okay.
Yay, pathology.
Yay! Thank you so much for your help. I appreciate you and look forward to working with you again. Thank you so much for your time. And thank you for correcting me and teaching me a few things. I really appreciate it. You have no idea.
Anytime.
All right. So, Mr. David, would you mind ending this recording and we'll start microbiology?
Sure.
All right.
So thank you very much. I really do appreciate Professor Cain and Megan for doing this section. It's a great section.
I think we collaborate well. We seem to work well.
One of the most important things about pathology, and don't let anyone fool you, is that you got to know the pathology terms and you got to know these, because when you get a death certificate and it says an illness on it, you're going to want to know what that illness is so that you can prepare yourself, when you're handling the human remains. So very important. Pathology, microbiology, two of the most important subjects in mortuary science. So thank you very much. Next section will be microbiology.
Are we done recording?
We are.
Okay.
Right.
I want to share something with you.
Go ahead.
So, you know that amoeba that eats your brain? And it was incredible. It was considered very rare. Now I'm in South Carolina, so it's not as rare here. We had a case here a couple of years ago. The person died. It was a child or teen.
Creutzfeldt Jacobs.
No,
that's a prion, but an amoeba would be
was an amoeba that was
in
found in still water.
Oh, yes.
Okay.
Got it.
We had a gentleman. So I told you I was an autopsy tech for a minute. We the pathologist I was working under, she was studying this amoeba. She wanted to figure out how to stop it from eating your brain. The problem is it is incredibly fast acting. So this man, he went fishing and he jumped in the water to go catch something that he dropped. He went home. 3 days later was found and his brain was completely melted. And when she had all of us stand back, she cut his cranium open, collected it, you know, those Chinese takeout containers that they have filled with formalin. And she's had that sucker soaking in formalin for like almost 2 years now. It still has not firmed. She can't do anything with it. It's incredible.
Wow.
Right?
Yeah.
It's a wicked amoeba. I don't go swimming here. I go in the ocean maybe. I live by the river. People can go and enjoy that. I'll look at it. Good enough for me.
Great. Well, looking forward to the next section.
All right. It's 8 o'clock. Let's do microbiology. All right. Save. Open. All right. And that's going to go ahead and conclude this recording for Microbiology's Glossary from David's notes. I hope that you guys enjoyed it as much as we enjoyed recording. It was a lot of fun working with Miss Cain and and David. I really like Miss Cain. I hope she's a reoccurring, and it seems like she will be. I really like her. And just so you're aware, she is an educator. It's not like I'm just having these random people other than, David, I'm not having random people come on and help. She is very knowledgeable in these subjects. Like we've started embalming. We did about half of it. And me being a trade embalmer, I was able to add my own, but she's able to add very, very useful information. So when you see me co-host with her, you want to listen to it. Okay? It's not just me reading notes, and it's a good thing. So anyway, I hope you guys have a wonderful day or night, weekend, week, whatever this is. If you have an exam coming up, good luck. You have me cheerleader pom-poms in the background rooting for you. You've got this. And you know what? If by happenstance you don't, it's okay. You didn't fail at anything. Okay? You have another try. You will pass the second time. Not like Gandalf. No. You will pass. Slam staff. Okay? You have this. I believe in you. If you need anything, if you need a friend, if you just need a support system, look for me on Facebook. I hate to say that's like my only real, I know that's kind of sad and very millennial of me, but that's like the easiest way to get a hold of me. Either fan mail me with your email, because otherwise your fan mail just sits there. I can read it, but I can't reply. You include your email, we can email, or find me on Facebook, Megan, Meghan, Opocensky, Ocensky. Once you type OPOC, like in cat, there's not very many of my clan, so that should immediately pop up. Just look for like the weird redhead with the cat. You're good to go. So anyway, just want to wrap this episode up. Thank you guys for your continued support and patience. It means a lot. Thank you for everything. You guys have helped make this podcast a reality. something I always wanted to do, and I'm so glad it is helping so many people.